Hi everyone. Today I shall be discussing about lipedema in different stages of life. That is lipedema during childhood and adolescence, early adulthood, middle age, and in later life. So now, if you look at this particular condition called lipedema, as we already have been discussing time and again, it is a chronic condition characterized by abnormal accumulation of fat in the legs, thighs, buttocks, hips, and the arms. Now, this lipedema fat can be quite symptomatic or sometimes relatively asymptomatic in the form that, in the sense that some patients experience a lot of pain. Some people have a moderate pain. Some people have pain on pressure, and they tend to bruise easily. They tend to develop spider veins or varicose veins, and so many other factors. And it is predominantly seen in women, especially from the time of puberty to menopause or beyond. Now, it is the world statistics says that there are approximately around 10 to 15% of women affected globally. In some areas of the world, it is approximately around 6 to 7%, but in some pockets, it is could be as high as 30 to 35%. So, on an average, if you just even out the statistics, it is approximately 10 to 15%. In India, we have just started to begin a survey on to find out the incidence of lipedema in India, along with IIT Hyderabad, OJUS Aesthetic, IIT Hyderabad, and Andhra Mela Sabha. So this is an initiative that we have taken up in India, and we hope that in the near future we should be able to come out with in the correct statistics as far as the lipedema in India goes. So now, if you look at lipedema primarily occurs in women. It rarely occurs in men. So we shall discuss more about the lipedema in women. The onset is starts somewhere during. It can start in early childhood itself, but usually the symptoms are seen from puberty. So this is because there are a lot of hormonal changes. There's a sudden spurt of estrogen, progesterone in women with diminished levels of testosterone. So, and as it can start at around puberty and can progress through each pregnancy and even during and after menopause. Now, if you look at the symptoms, what are the symptoms that you need to look uh, for a patient suffering from lipedema or those who are affected with lipedema? Usually, at this stage, you start noticing that there is these girls, uh, as they grow normally, they tend to start putting on abnormal amounts of fat symmetrically in the legs and the hips and thighs. The skin may become softer and more pliable. Sometimes it could be stretchy, like a small little rubber band. So they're more elastic and you know they're more flexible. So sometimes you may find that they can do their yogasanas and other kind of stretches and other things more than the other normal and their counterparts, their friends. So these are some of the features. The joints may be more flexible. They can bend the fingers more than the others, and such kind of things. Uh, then, so these are some of the symptoms, early symptoms that you notice. And the challenges that you find is, it could be difficult to identify lipedema in these patients because, uh, you know, uh, children at that age, some of them tend to be overweight, some of them, do become obese as well. So, and the food habits and all those things could be relatively similar. So, these are some of the things which pose challenges in the correct diagnosis of lipedema. And in the early stages, they look quite normal, and there is the only thing that these people experience is peer pressure and psychological stress because of these kind of body changes that are taking place, and sometimes they could be ridiculed not only by the friends but even by their own family members, saying that oh, you are not taking care of yourself. You should be more particular about your diet. You should be doing more exercise. Even though they may be doing exercises, they may be doing dieting and other things. They may be on a relatively healthy diet. The minute they are found to be holding an ice cream or a soft drink, immediately all fingers point to them, and that could lead to psychological stress. Now, as we progress into the adulthood, that is the early adulthood, that is around the 20s and the 30s, this fat deposits continue to increase. There's a progression of this particular deposits of fat, and the affected areas may start to become initially maybe non-tender, but slowly they start to become painful and tender. So, and then they also might start noticing swelling, which may not pit on pressure. That is, when you press, it may not leave an indentation, but at the same time they bruise very easily. So a small little trivial trauma, which usually which goes unnoticed, might lead to a bluish patch, which takes approximately 3 to 4 weeks for it to subside. And these women, they start noticing that there is a irregularity in the skin. The skin is not smooth like before. The skin starts to become wavy and nodular, and some of these areas may become lumpy, like small marbles, peas, or little walnuts, or lime size, odd shapes. And sometimes they these people, they begin to start feeling, some of them may start to feel heavy on the legs. They become tired very easily, and they, especially when they stand for long periods of time or walk for long periods of time, they may not be able to walk at the same pace as their friends. So these are all certain things that start to pose challenges towards them, and then because of this, there could be a lot of psychological impacts, including low self-esteem, body image issues. These are quite common. They don't fit into the right kind of clothes. The upper body needs a smaller size. The lower body needs extra large size clothes, and all these things lead to lead them to become something like a social recluse. So managing weight becomes a challenge after some time, because obesity could also set in because of the inability or the difficulty to do proper exercises. Starts to add to the complications, which may lead to features of overweight or obesity. And when obesity and lipedema coexist, then the challenges for the woman becomes multifold. So now, as we go into a little more elderly, that is middle age, there's the 40s and 50s, you find the stage also starts to advance, and so there's more deposition of fat, and the lipedema stage keeps also progressing. The fat may become harder, and this hardness is because the fat becomes more fibrotic, and there is more amount of lymphatic stasis. That is the lymph which flows freely under the skin to maintain a good health, because they're weak, and there are a lot of extra fat deposits, and the lymphatics start to become kinky and wavy and pattern. The lymph flow gets sluggish, or hampered, and there could be lymph oozing out of the lymphatic tubes into the surrounding tissues, soaking the fat and surrounding structures, causing inflammatory changes. And these inflammatory changes can result in more amount of pain, more lumpiness and nodularity of the fat under the skin. And as this increases, it starts to tend become tending towards lymphedema, that is lymphatic stasis, causing abnormal swelling, heaviness of the legs, early fatigue. They can't walk properly. Their leg becomes so heavy that it looks like as if they have to drag themselves along, and it becomes quite a misery for these ladies. So the lymphatic system becomes compromised and the swelling keeps increasing. And then as the disease progresses, as the age increases, the disease also progresses. And as it goes to around 60s and beyond, it becomes so difficult that they may not be able to even stand or walk, sit properly, and so much of fat between the thighs, on the buttocks, on the saddlebag areas. Wearing clothes become difficult. When they try to walk, even in the earlier stages, the inner thighs might rub, causing chafing of the skin, causing excoriation, hyperpigmentation of the skin in that areas, frequently developing small ulcers, sometimes developing fungal infections. These are all different issues which they face and find it difficult to even discuss with the doctors, because many of the doctors are also unaware of the fact that of this particular condition called lipedema. So every stage of life is a challenge for the woman affected with lipedema. It is very essential that early diagnosis is crucial in all stages of lipedema. And if lipedema is suspected, seeking the help of a healthcare provider who is knowledgeable in this particular condition is very much essential, and taking the treatment in the right direction. Because the treatment for obesity is totally different from the treatment of lipedema. Though there could be a few similarities, but most of the times it is totally different. So once you come to a conclusion that this is lipedema, of course there is no permanent cure for lipedema, but you can always treat, manage the symptoms, and keep the disease under control, so that the woman can lead a near normal life, if not a complete normal life. So these treatments can include compression therapy, manual lymphatic drainage, exercise, as tolerated, diet, especially an antioxidant, anti-inflammatory diet, which is relatively free of carbohydrates, or with limited carbohydrates, and if you're taking carbohydrates, it should be complex carbohydrates. And of course, it has been found that so far liposuction, water-assisted liposuction, while protecting the lymphatic system and the venous system, these are specifically designed liposuction methods, can remove the unnecessary, unwanted excess lipedema fat, and so that the lymphatic system and the venous system can function better, and the patient can fare better. And they also can fit into the right clothes. They can also be able to, sometimes even if they want to wear compression garments, it may be difficult to wear compression garments because of the excessive folds, the excessive fat deposits in unusual areas. So, like for example, at the ankle or at the knee or at the groin, if there are excessive amount of fat pockets, and in mid-thigh there is a skin fold, the fabric goes into those areas, and when they try to sit, stand, or walk, those folds might apply so much of pressure in those areas, it might almost sort of cut through and cause severe pain. So all these things can be avoided by doing a graded, calculated liposuction, so that the woman can get a very good relief by getting rid of the fat, getting rid of the fat fold, the skin folds, and getting rid of the volume, reducing size, and they can fit into even much better, trendier clothes, and also wear the compression garments more easily. They can get into the compression lymphatic compression pump, which can also perform much better in a much better way, and give them good results and relief. Thank you. If you have any questions or any queries, you please feel free to contact 95151 or you can contact us at Ojas Aesthetic, Madhapur, Hyderabad, or you can log on to our website www.lipidema.in. Thank you.